Okay, so module 2, chapter 3 textbook assignment looks like this for the most part. And we're going to walk through what the first of all is the main term of which that you need to look in the office section of the book, which is the front of the book. That looks like a phone book from A to Z. Okay. The first one is Archresis infestation. So your main term is going to be infestation. Okay, so you're going to go to the eyes in the alpha section in the front of the book of your coding manual and look up infestation. Okay, and then from there, you want to go back down and look for that archresis. Okay, which is going to be at the beginning of infestation. It says C. archresis. So we're going to go to the A's. And go to ACAR. Okay. And then you're going to find your code. You're only looking for the words of which that are on there. Now, if I was using the encoder, which it looks like it logged me out, so I need to actually get back in there. And this should do it. Okay, so we're going into coding and then coding books. And we want to make sure that this one's not marked, that one is. We're looking for AC. ACARIA, ACARIA. IASIS. Okay. Did it come up? Okay. It's previous. We're going to look down here and see if we can find it here. Abscess. ACAR. Accessory. Instructional notes. Let's see if it comes up down here. Okay, instructional notes here, ACAR accessory, term matched. Okay, and in the book, if you notice, it has that, the main term, or it has actually the a scabies version. Okay. And so we actually just want, we want the one without the scabies. Okay. Now we're going to go to the back of the book and you're going to look up that code. So write that code down, then go to the back of the book and you find that code and you look to see if it's coded with all of the characters. So we want to go to, I'm just going to say the B88.1. Okay. So we go to B88.1. And it says in front of B88 that you need 4 characters. So you're going to, choices are B88.0, 0.1, 0.2, 0.3, 0.8, 0.9. So that's your code set of which you get to choose from. So you choose the appropriate code. And again, look for those verbiage of which that you're looking for. Okay. The actual words that we're looking for. And underneath it, if you see the bold print is your main, but underneath it is there additional information of which is part of that main code. So under the code, it says other accuracy is actually the main term, but underneath it, it says carnine dermatitis, dermatitis due to DMX species, dermatitis due, and thrombocytosis. So we have a specific type, but this is one of those times it's the NEC, NOC thing. We have the specific type, but we do not have it listed in here. So we use the B88.0 for other. Okay, so this one's kind of a tricky one because the words don't actually appear on there, but we do have the acarisis, which is actually what we're looking for under the B88.0. So that's the one we want. Okay, so let's go back to I'm gonna move my window here. Okay, and we're going to go back and we're going to try the next one. So the next one is pityriasis rubra pilaris. So you can look at pityriasis or you can look at pilaris, but I would look at pityriasis is what I think it would be. So go ahead and look that up if you want to. And it's P-I-T-Y. Okay, and then that's your main term, pityriasis, down to rubra to find your code, rubra hebra pilaris, find your code. Then after you get that code, you want to go to the back of the book and make sure it matches up. Okay. So we're going to take a little time here. Go ahead and look that up. Okay, if you found that and you verified your code, you're doing good. All right. What you need to do again, pityriasis is your main turn down to rubra, I guess is what it is, hebra pilaris. Then you want to go to the back of the book and you want to check your code and make sure it is correct. Okay, and you have all your characters. So for this circumstance, if you found this code, you would look and see, does it have any other code, any other numbers with it, and if it's coded correctly. Look for that little red box in front of the main code to determine how many characters you need to have. That's very important because if it's not coded to the full extent, it is incorrect and wrong. Okay, so let's try the next one, number 3. All right, this one is admission for adjustment of artificial leg. Now, this one here, you're actually, what is the main reason for being seen? They're being seen for an admission. So this is another tricky one because they, or you can do admission or adjustment, either one. So with this one, let's try admission in the alpha index. Down to Adjustment, if you got it. So we'll see if we can find adjustment in here. Adjustments are in here. And what are we adjusting? An artificial leg. So we can find a leg in there. Okay. Is it a complete or partial? It doesn't say. All right. So we're going to do, looking at that artificial leg code. We're going to go to the back of the book. We're going to look that code up and check for that little red box to tell you how many characters it's supposed to have. Because this one, I can tell you, it's not completed. You need to add more characters. Okay. So you're going to want to do that. All right. I'm going to give you just a little bit of time to look at that one in the back of the book. Okay. All right. Remember, you can stop and start this at any time and then start it back up again if you want. Okay. The next one is anorexia nervosa. Now, oh, sorry, we skipped a few here. Okay, going now. Okay, mission, we did that one, number 3. Pityriasis, I think we did that one. Okay. So number 4, adjustment disorder with anxiety, number 4. So this one here, you might want to look at anxiety as your main term. So let's see if we can find everything with an anxiety. So ANX. And down to adjustment. And if you can't find it there, we have an adjustment disorder with anxiety. So if we can't find it under anxiety, then we're going to go to disorder. Okay, so D's in your book, disorder, adjustment disorder. So adjustment disorder down to adjustment. And then you want to look for with anxiety. And then you want to look in the back of the book for that. Okay, if you want to do that, find your code and look for that. Again, anxiety down to, we didn't find it that way. So now we're going to look for disorder. Disorder down to adjustment in your alpha section. And then from there, we're going to get to with anxiety. Okay, and this is exactly what we did in the book. We went to disorder, we went down to adjustment, we went into with anxiety, and we found our code. We're going to the back of the book and we're going to determine whether it's coded to the full extent or not. Remember, again, looking for the red little box to tell you how many characters that code needs to have. Okay. So with that, we're just going to go move on down each one of these and we're going to determine the main code, the main term, and make sure that we know. Anorexia nervosa, anorexia, okay, is a disorder, and then down to nervosa is the type. Costin's complex, you can actually look at the main term of Costin's because Costin's is the name and eponym of a diagnosis. So you can actually look it up by the first or the last name of the person who created it. Okay, you can try under complex too if you want. Usually you can look it up both ways. Okay, Madelung's deformities, again, probably can look it up both ways, deformities or Madelung's. Okay, Coates disease, disease is the problem. Coates is what's wrong, the type of the disease. Okay, so disease is your main term. Cashin-Beck disease, again, disease is your main term because that's what's wrong. And then the type is Cashin-Beck. Okay. Meniere's disease, there's another one, disease to Meniere's. And then you want to look down to make sure you get your right ear. So that means that if it doesn't code to the full extent, which it won't, Go to the back of the book and look for that character for the right ear. Okay. Purpura, there you go, one word. Femoral hernia, hernia is the problem, femoral is the location. Okay. ST elevation, myocardial infarction, anterior wall. This one's a little complicated. Let's walk through this because when you get into the MIs in the book in the office section, it gets a little complicated. So ST elevation, myocardial infarction. Infarction is your main term. So you want to go to infarction in your book. Okay, infarct. Okay, infarction, and then you want ST myocardial. So you want to go to infarction myocardium, and then ST, and it does say elevation, and it's the anterior wall. So you want to find the code for the anterior wall. Okay, so, and then check your code in the back of the book. So this one here, we want infarction. Okay, and then we want to go down to myocardium. Next. Oops, I spelled it wrong. I wonder I can't get there real quick. Okay, get to myocardium, then we want to go down to ST elevation, down to anterior wall. Okay, and then we want to go back and check and verify our code to make sure our code is correct. Okay, so I'm going back here because I might have a code I need to fix. Answer key. Myocardial infarction by other coronary arteries or anterior wall. Does it say? Now you have to be careful with this one because I came up with, well, I guess it must be right. I don't have an I-21. Okay, let me fix this. Okay, so now that we got our code, all right. So let's keep going on here and see what else we got. So we've done one infarction now, so that's good. That's a good place to work on because that is a really tough section with all the indentations in there, with the indentions of, with the including this and things of that sort. Next one only has one word, hyperinsulinism, so that's okay. Laceration right eyeball, laceration is going to be your main term. Make sure you get all those characters. Look for that little red box to tell you how many characters there are. Acquired acanthosis, that one, acquired is a type. So acanthosis is what's wrong, and acquired is actually telling you about the condition. So it's a descriptor, okay? Malaria fever, you could probably look at fever and then malaria, or you could look at malaria. Let me look here and see. Malaria. You can look at malaria. Let's try fever. Fever might be a little harder because there's so many different types of fever. So it might be a little longer for you to find it under fever. And we do want to look at, see, there's so many different kinds of fevers in there that you're going to have to go through a lot of alpha to get to it. So, but I'm sure it's probably in here. Let's see. Malaria, it's going to send you to malaria anyway. So there you go. Okay. All right. Next one. We have dimorphous leprosy. Leprosy is the diagnosis or the main term, and dimorphosis is actually the type of leprosy. Okay. Acute pyogenic thyroiditis. Thyroiditis is your main term, and the type is the pyogenic, and the descriptor is acute. So you want to make sure you look for all of those words when you look them up. Okay. Neuritis due to beriberi. Okay. This one here, let's try looking up neuritis, NEU, and see if we can actually find it under neuritis. It is a diagnosis, inflammation of the neural system. So neuritis, and we're looking for due tos. So look down until you find due to. Okay, it's going to be a little bit A, B, C, D, E. We get to due to and beriberi, and you should be able to find your code. And then once you find your code, go back to the back of the book and make sure that the code is correct. Okay. Next one, epilepsy is your main term, because pharmaco resistant is actually a type of epilepsy. So epilepsy, and then look for the pharmaco, and then you should be able to find your code. Treatment resistant epilepsy, again, epilepsy main term down to treatment resistant. Refractory epilepsy with status epilepticus, which epilepsy is your main term. You want to go to refractory, and then you want to go down to look for that with status epilepticus. Okay, so let's try that one. Epilepsy. Okay, epilepsy down to refractory. See, epileptic. Impulsive vocalization. Okay, can you find it in there? If you can't find it in there, we might have to go to, I can't believe it's not in there. We can go down to epilepsy with, right after the main term epilepsy with, and look down and see if you can find it under there, which is complex partial, grand mal, myoclonic simple, ascrinic, benign, brave in childhood, absence, climate destruction, focal, generalized, impulsive, intractable, juvenile, vocalization, idiopathic, myoclonus, on awakening, related. Now I found intractable, not intractable. All right, so let's go under, because I want to get somewhere. And sometimes when you can't find it, then let's just pick something that's close. So epilepsy down to, let's do intractable to find at least a code to start with. Okay, so let's go to epilepsy intractable, and then which is G40.919. And then we're going to go to the back of the book to G49.9. Okay, G40.9 says you have to use 5 characters. Okay, so 90 is epilepsy unspecified, not untractable, or 901 is epilepsy unspecified, not intractable with status epilepticus, or G40.909 is epilepsy unspecified, not intractable without status, or epilepsy unspecified, intractable seizure disorder is 91. You still need this one here. You need 5 characters. So epilepsy unspecified, intractable with status epilepticus, or epilepsy unspecified, intractable without status epilepticus. So I think we want actually the epilepsy unspecified, because they really didn't tell us, intractable with we want the epilepticus unspecified intractable with status epilepticus. So we want the G40.911. Okay. If we look up in the actual Google, if we Google this, it's probably going to say that it's intractable. So that is one of those times that you might have to do Google research to find out. But we're going to get down to G40.911 is where we're going, which is really close to what we found in the front of the book. Okay. All right. That one's a tough one. Okay. Looking at the next one, poorly controlled epilepsy with status epilepticus. All right. So again, with the epilepsy, you're going to go back to the same thing. The poorly controlled is probably something you're not going to find, but you want to go to that epilepsy with status epilepticus, and you're probably going to end up having about the same number. Okay. Next one, malignant mesonephroma, right ovary, primary malignancy, neoplasm table. Okay, now we're going to go hit the neoplasm table on this one. And I'm going to see if I can bring up a neoplasm table on here and see. Okay. Here we go. Oh, good. Awesome. Okay. When you go to your book, after the alpha section, there is the neoplasm table. Okay. In your book, it probably should be dark black on the tabs on the side of the book. If you see this, it's probably dark black. It's right after the alpha section, and it should look like this. You're going to see neoplasm table, and you're going to see this. And it's the columns as a matrix. This is the primary neoplasm column, secondary, cancer in situ, benign, uncertain, and unspecified. Okay. And I don't know if I remember if I told you about how to read this, but I'm going to go through it really quickly. Okay. Any lesions of skin or anything like that is always going to be in your primary column. Okay. Sometimes they're going to say metastasized, which means that's the secondary column. Okay. If they say a metastasized lung cancer, primary site unknown, you're going to code this code here, go down to lung, then you're going to find your code in the secondary column, and then you're going to code this one code right here, C80.1, for that primary site unknown. Okay, so this is really important. So one more time, if it's a metastasized site that's spread to that has come from another site, a primary site, but you don't know what the primary site is, you're going to use the metastasized column first for that body part of which they're talking about. And then you're going to code from the primary column C80.1 for primary site unknown. Okay. But if they tell you a metastasized site, the lung, and it came from another organ system, then you would look up lung on this column, which, let me see if I can get on here and see if it comes up. There it goes. So you go to in the book, in your table, you go to neoplasm to lung, which is, this is what's going to look like. And you have different types of different places of which the lung can be actually be coded for. So if it's a middle lobe, then you're going to use this one. But if it's a metastasized from the metastasized lung, you're going to use like middle lobe, C78.0, and you're going to go to the back of the book and find the rest of your code. And then your primary, if it tells you your primary, then you're going to go find your primary. Okay. And then you're going to code that to the full extent. Okay. So it's all dependent on how they state it. If they just say patient being seen for lung cancer of the lung, you're just automatically going to use this one, C34.9, unless they say that it's like the lower lobe, then you're going to use this one. And remember, you have to go back to the back of the book and finish your code out. Now with this one here, it says it's a primary malignancy, so you're using the first column. You're going to go to mesonephroma, and it's the ovary. Okay, so we're going to go to ovary here. Okay, so you're going to go ovary down to ovary in your neoplasm table. It's going to look like this. Okay, and let's see what else it says. So it says malignant mesonephroma, right ovary, primary malignancy, neoplasm table. Okay, so with that, we are going to do probably, did we see meso in here anywhere? No, we did not. Under ovary is just ovary. So we're going to do primary C56. And from there, we're going to go back and we're going to code to the full extent. Okay, so that would be that one. All right. Next one, malignant embryoma, right kidney, primary malignancy, neoplasm table. So again, we're going to here, we're going to go here, but instead in the neoplasm alpha, you're going to go to kidney. Okay. And you're probably not going to find the actual type of cancer that they're talking about, embryoma, primary malignancy, neoplasm table. And you're going to go down and you're going to look at your code and you're going to find your code. Okay. This is the primary. So you're going to look at this column. Okay. And you're going to go to the back of the book, look that code up and determine what the rest of the code is. Okay. Remember, look for that red character to determine how many, or red numbers to tell you how many characters you need for that code. Okay. Bowen's disease is actually your main term. You could go to Bowen's, or you could actually go to Bowen's and find your code too. I think you can look at both ways. Okay. Ethmoid sinus tumor, neoplasm table. So it's not telling us which actual column to look at. So we actually want to go to the alpha section and look under tumor. And this is going to maybe give us some cross-reference. Let's see. So we're going to look at tumor, and then we're looking at ethmoid is the body part. So we're going to go down to ethmoid. And I am not seeing ethmoid in here. We can actually look at sinus and see if we can find sinus in here. Skin, sex, salivary, tumor. I don't see it. So we're going to go to the main term tumor in the alpha section. And it says, see also neoplasm table, unspecified behavior. So that's the column we're going to use. So we're going to go to, we are going to go to the neoplasm column, and we are going to look for, let's see, it's a tumor ethmoid sinus. So let's try sinus. Okay, and let's see if we can get down to the ethmoid. We sure can. And this one is uncertain behavior. So we got to go all the way over to uncertain behavior. And we're going to hang out in that area. Did it say uncertain or unspecified? Ethmoid. I think it's, you're supposed to actually maybe use the unspecified code, if I'm not mistaken. Which question is this? Question number 1. Yeah, you're supposed to use the unspecified. Okay. All right. So let's go to the next one. Basal cell carcinoma of the skin of the external cheek, neoplasm table skin. Okay. So in the neoplasm table, this is a hint that tells you have to go to neoplasm table and then you want to go find skin. And from then you want to look at the body part, which is the cheek. And then from there, what is a basal cell carcinoma? So is that malignant or is it benign? So I know it's malignant, but if I was going to go to carcinoma here in the front of the book, it's gonna tell me. Okay, so carcinoma in the alpha section down to basal cell is going to give me instructions to say basal cell, pigmented, see neoplasm skin, malignant. Okay, so you want to use the malignant column. So again, we want to go neoplasm, and then we want to go to body part, which is cheek. And then from the cheek, we want to go to basal cell carcinoma, and we want to find our code. And then we want to go to the back of the book and verify our code. Okay, so you go to cheek, skin, then cheek is where you want to go. Again, we can do this. I did cheek and found that code, but I can go to skin. Okay, here's the skin, and then we can go down to skin face. I found it easier just going to cheek. Face gives you skin, ear. So let's go to cheek. Yeah, see, I think you can find your code easier if you go to cheek, but it's a basal cell. So there you go. You can find your code. Okay. Next one, carcinoma of the liver, neoplasm table. Okay. It doesn't say anything about metastasized, so it's automatically we're thinking it's primary. So we're going to go to the neoplasm table. We're going to go to liver, and then we're going to find our code. So with this one, if you want to take a quick peek at what it looks like in the book, okay, neoplasm, and we're going to liver and over to primary column. Okay, and then we're going to go verify our code. Okay, prostate cancer, same thing. Nothing about metastasized primary, secondary. So it's a primary automatically. We're going to go to the prostate so we're going to the neoplasm table down to prostate. And if you want to take a look at what it looks like, prostate, and it's going to look like this, primary column, and then you're going to go back and verify your code. Okay. Again, if you don't verify your code and code it to the full extent, it's going to be wrong. Okay. So you want to make sure you do that with every single one of your codes. Okay. All right. Poisoning due to inhalation of pain and fumes. Okay. Now this is the other table in the book. Right after the neoplasm table is the drug and chemicals. The drugs are actually alphabetized from A to Z, which is really nice. Okay. So, what you want to look for here is paint fumes. Okay. So we want to go to the P's, and hopefully we can find it. Okay. So we want to go the poisoning table to paint, and then we want to find fumes, and it's accidental, obviously. All right. Oh, it's an unspecified, poisoning unspecified. because they probably did it while they were working, poisoning of that sort. So we don't know if it was intentional or not. So we're going to do the unspecified column on that. So the columns are accidental, and then there's self-harm, assault, poisoning unspecified, adverse effects, or underdosing. So we want to go the unspecified here, poisoning unspecified, to find our code. Okay. And go to the back of the book and verify your code to get all of the characters, because these are not going to be coded to the full extent. Okay. Circulatory collapse due to therapeutic use of magnesium sulfate, oral tab and chemical index. Again, table for drugs and chemicals. So the drug of choice we're doing is magnesium sulfate. So you want to go to the M's, which is not too far back. Okay. Magnesium sulfate. And then we got magnesium. We want to go down to sulfate. Okay. And then from there, we have circulatory collapse, which is something that happened due to the therapeutic use of magnesium sulfate. So we are going to code the magnesium sulfate as our second code, but we're going to go under here under sulfate, and we're going to find our code. Okay. And it's going to be an adverse effect. Okay. So they had something happen because they took a medication. So it's an adverse effect. So it's going to be a T code. You look that code up, adverse effect column, go to the back of the book and code it to the full extent. Now I can tell you anything in drug and chemical is probably going to have an alpha behind it. And you're going to find that box that might be in pink or something that tells you which alpha to choose from. And A is for initial, that type of thing. So you want to make sure you put that on the back side. If you do not have enough numbers to actually come up with 7 characters, because a lot of these will have 7, you need to put an X in there to fill that last spot in order to get your alpha on there. So I just wanted to talk to you about that too, about how to fill in the numbers. So if you need 7 characters and you only have 5, then you're going to need to have, and you need that alpha on the backside, you're going to have your 5 characters. You're going to put an X, and then you're going to put your alpha on the backside. In this case, you just have to add the alpha, I do believe, okay, on the backside for this one. Okay, the first code is going to be circulatory collapse. So we're going to go to collapse in the front of the book, because they have to treat that. So we have to put that in there. So collapse. Let's see. I'm on the spell. Okay. COLLAPSE. All right. Okay, collapse, which is actually starts on one page and goes to the other, and it's circulatory. So you find your circulatory code, and then you check your code in the back of the book. So with this one, you're going to have an R code in the front. You're going to have a T code on as a second code. How you write those down is code, comma, code. So that's how you list them. The code, first code, comma, the second code. Okay, so this one has 2 codes. Okay, the next one only has 1 code. Accidental overdose of antidepressant initial encounter. So this one here, you're going to go to antidepressant. From there, you're going to go to the column for accidental overdose. Okay, accidental. And then you're going to go to the back of the book, and you're going to find all of your characters. This one's going to need initial on the backside, an alpha on the backside to say initial encounter. Okay. This one here, you do not have to put X's to fill. So that's good. Okay. Meningoencephalitis, this one should be okay. All right. That you should look that up in the back of the book, and then, or at the front of the book in the alpha section, and then look it up to get all your characters. Let's see. This one here might have, no, nephrosclerosis. Okay. Nephrosclerosis. So let's look at this one. Nephrosclerosis, NEF. For some reason, I have two codes, so we better check it out. NEPH, nephritis. Okay, nephrosclerosis, arteriosclerotic, hyperplastic, C, hypertension, kidney, senile, N26.9. Okay, so nephrosclerosis, arteriosclerosis, chronic, highlight, see also hypertension, kidney. So let's go to hypertension and then kidney. So hypertension in the office section. Okay, hypertension down to kidney. Okay. Okay, there's your first code, hypertension kidney. That's your first code. And you want to look that up in the back of the book. So let's go back to the back of the book. And that one was I-21.9 when you look it up. So like I said, you can stop this anytime you want to. We'll go find the code. And then go from there. So I-21. I-12, sorry. I'm having dyslexia today. I-12 is hypertensive chronic kidney disease. I-12.0 is hypertensive chronic kidney disease with stage 5 chronic kidney disease or end-stage renal disease. I-12.9 is hypertensive chronic kidney disease with stage 1 through stage 4 chronic kidney disease or unspecified chronic kidney disease. Now that's the one we want to use because they don't tell us which stage they're in. So we have to use that one that says unspecified. Okay. If you look at I-12, every single one of those says that you have to use that stage in order to determine the secondary code. So you have to have that code attached to it. Again, it's with the red notes. Use the additional code is what you're going to see, which means you have to add it. Okay. Next one, anastomatic ulcer. Ulcer is your main term, and then you want to look for anastomatic. Right. High blood pressure, that is not automatic. This one here, high blood pressure, it's probably going to give you an indicator. So pressure to go to a different spot. So to look. Pressure down to trachea, brain, increased intracranial benign, injury, necrosis, or ulceravenous. Pressure. I don't see anything under pressure that would classify me as using my code. So I'm going to go under high or increase if you want to. Let's see. Incontinence, increased pressure, intracranial pressure, doesn't say. Under increase, high, is the next one I'm looking for in the office section for high blood pressure. So CHI high down to blood pressure, C hypertension. Okay, so we're going to go to hypertension. I just don't want to assume. I don't want you guys to automatically assume you have to go to hypertension, because there is an indicator where increased blood pressure or something of that sort that does not constitute hypertension. But okay, so we're going to go to hypertension, and we're going to go to the main term or the main code there under the main term. So, and check your code, make sure it's correct. But eventually you're going to get to the point that when it says hypertension, you're going to have that code memorized, because the book you're using is ICD-10 and the code that is for hypertension is I-10. So it is a code that in internal med is used quite a bit. Okay. Pharyngitis, acute is how you're looking, pharyngitis down to acute, and you should be able to find your code. A cardiovascular disease of the native coronary artery. Okay. This one here, it's not as hard as it looks. Disease, cardiovascular. So disease to the C's, that rhymes. Okay, so disease, K to cardio. Cardiovascular. Okay, and then you just check your code in the back of the book to make sure it's correct. Okay, and if it's cardiovascular disease, native artery, it's a coronary artery, it's a native artery. That might come up when we do myocardial infarctions. You might want to take note of that. That coronary artery is a main artery or a native artery. Okay, arteritis should be okay. Absence of menstruation, absence and then menstruation. Herpetiformis dermatosis. Okay, dermatosis down to herpetiformis, and that should do it. Dextrocardia is an easy one. Meningeal tuberculoma of the brain and spinal cord. Tuberculoma. That one there is a one coder, and oh, it actually has two codes. Okay, so let's look this one up. Okay, so we have meningeal tuberculoma. So tuber. See also tuberculosis. So it's just down a little bit if you can't find it. And it is meningeal, right? So there is a meningeal one in there, and that one will be fine. And then it says of the brain and spinal cord. So the brain, you're going to add the brain and then the code for that. And then if you look, spinal cord is probably the same code. So you only have to add the code once. You never add the same code twice. Okay. All right. Malignant neoplasm of the dorsal surface is the basal tongue. Neoplasm table, basically you want to go to tongue, and it's the primary column because it's malignant neoplasm of the dorsal surface. You want to go down and see if you can find, once you get to tongue, dorsal surface, and see if you can find it. They don't say anything else, so this is obviously a primary. Sucrase isomaltase deficiency. Deficiency is where you're looking here for this code. Okay. This one, it might need two codes. Okay, so deficiency on this one. And then with the type, which is sucrase with an S. Okay. There's a lot of deficiencies. Okay. We have sucrase and isomaltase are two different codes. So make sure you check your code in the back of the book when you look at these, because I can tell you right now, be very close, pay close attention to that last character on the codes to make sure they are correct when you go to the back of the book. And then once you get that sucrase, you want to go over to the I's in this section and find your other one, which is isomaltase. Okay, and let's go to sucrase in the back of the book. E74. E74.3. E74.3, disorder of the intestinal carbonate absorption, sucrase isomaltase deficiency. It is back there. You need 5 characters. It looks good. And there's E74 has no notice of anything else. Okay. All right. Let me circle this one. Okay. And I think there's one back here that I need. Yeah. Okay. I need to check that one. Okay. All right. Moving on. So that's that one. There's actually one code. Okay. It's not 2. Okay. Next one, psychotic disorder with hallucinations, paranoid schizophrenia. Okay. This one here does have 2 codes. So disorder is your main code, and then psychotic. Okay, so, and then we went disorder to the P's. It's going to send you to psychosis. Okay, so you're going to have to go back up a little bit to psychosis. Psychogenic, psychotic. So we went to the P's and psychosis. Okay, so psychosis, and then we want to look down and find out what kind it is. With hallucinations. There's no dependence on here, it says. So psychosis, we might have to go to way down to see if they have any W's, but I don't see it. Okay. It's not alcoholic. We can go to psychosis, paranoid. Okay, down to schizophrenic, which is the F20.0. That's your second code. And then we want to look for, we still have to find that psychosis hallucinations. So psychosis with hallucinations. hysterical, hypomanic, hallucinatory, chronic. There we go. Psychotic down to hallucinatory, chronic, and you're going to find your first code. Okay. All right. And then check those codes in the back of the book to make sure they're correct. Hemorrhage from the throat, hemotysis. Okay. We can look at hemotysis. I'm not seeing it. Hemoptysis. And one page off. Yep, hemoptysis, you've got newborn or tuberculosis, C, tuberculosis pulmonary. So hemoptysis, let me check. The RO4 is correct. That's going to be your second code. You're going to have two RO4 codes, but your second code, these are actually separate diagnoses. So hemorrhage is the first code. So you want to go to hemorrhage and then the location, which is throat. Okay, and you're going to find your code for that. That's your first code, and your second code is going to be that hemoptysis. Okay, and again, they're both R codes. Acute ambric dysentery, dysentery, that one there should be fine, one code. Disseminated blastomycosis down to disseminated, and that's actually one code too. Dysentery on this one here, question one on 3.9, that is actually your main code or your main term. And then you're going to go to ambic, and then from there to acute, okay, for that one. Down to question 3 on this one on 3.9, we got megakaryocytic, thrombocytic leukemia acute. Okay, so this one is all basically indicators and descriptors for leukemia. So this one's going to be a little tougher because you got a lot of words to look up. So leukemia. Okay, leukemia, and then down to mega. I'm not seeing mericystic, thrombocytic. What's on the main term? Nothing. Okay. All right. We do have acute leukemia there under leukemia. Acute lymphoblastic. Oh, here we go. You have to look up acute first. So leukemia to acute. And then they have all of those subterms. Acute megakaryocytic is in there. Okay. And then you're going to have to finish your code in the back of the book. Okay. Let's see here. Let's go on. GM2 gangliosidosis juvenile. Juvenile is a descriptor. Gangliosidosis is what you're looking for. And then the GM2 and then juvenile. Okay. Make sure you verify in the back of the book. Congenital toxoplasmosis, one code there. It's a congenital, so it's going to be a P code. So toxoplasmosis is your main term to congenital, and then verify in the back of the book. Okay. Intussusception of appendix. Appendix is your location, but intussusception is where you're going. Now, down to appendix, and that should be one code. Okay, verify in the back of the book. Ectopic pregnancy, week 6. Now this one is a little complicated, the pregnancy codes, because sometimes we have more than one code because we have more than one thing to actually declare or tell them about it. So ectopic pregnancy, so we're going to go to pregnancy first in the office section, and the pregnancy section in the office section is huge. Okay, so we're going to go pregnancy, and then we're going to go, let's see if we can find it under complicated. So pregnancy down to complicated by, and then we want to see ectopic and see if we can find it. So we're going to go to pregnancy complicated, and then we're going to see if we can find ectopic. Ectopic pregnancy. And it says see pregnancy, ectopic. So what we're going to do is we're going to get out of the complicated section. So up in your headers where it says pregnancy up at the top, it says complicated by. We want to get out of the complicated. We want to get into the ease. So we're going to turn the page because we're on page 266 in our book, and we're into coronal. So now we can get into C coronial, and then it goes into ectopic. Ectopic rupture is what you're looking for. Okay. And then you're going to find your code, and then you're going to go to the back of the book and find all of the characters. Now we're going to have a second code here because they told us the weeks of gestation. Now to find the pregnancy weeks of gestation, you're going to go pregnancy all the way to weeks. Remember, stay out of the complicated part, go pregnancy to the end of this section of pregnancy to weeks. And this one is actually 6 weeks. Which is, it's actually the first thing on weeks of gestation is 8 weeks. So we are at pregnancy weeks of gestation. So we are going to, if you notice, the codes are based on weeks are 08 for 8 weeks, 09 for 9 weeks. So this one would be as and in Z3A.08 for 8 weeks. This would be Z3A.01 for actual 06, I'm sorry, or is it 01? 01 gestational. It says greater than 42 weeks at 4-9, less than 8 weeks. Oh, in the notes after 42 weeks in the book, it says less than 8 weeks, use Z3A.01. Okay, so you would use the Z3A. A is an apple 0.01. Okay, all right. All right, next one, hepatorenal syndrome. Syndrome to hepatorenal, and it should be one code. Okay. Arterial atheroembolism. Okay. Atheroembolism down to arterial, and you should find your code. Okay. Glaucoma. That one's easy enough. Don't read into it. Just the straight standard glaucoma code because there's nothing else there. Okay. This one here should have 2 codes. We have tetanic cataract in hypothyroidism because these are 2 diagnoses. So cataract first to tetanic, and then you're going to go looking at hypothyroidism. Hypoparathyroidism. Okay. Next one, cardiac carcidosis. That one, sardosis, and then cardiac is how you look it up. And that one should be only 1 code. Next one has 2 codes. Uremic pericarditis. I do believe this one should have 2. We'll check. Pericarditis. So pericarditis with the P's. Okay, pericarditis down to, and we're looking for the type, which was uremic. Okay, and then it has 2 codes there. This is awesome because this is actually a combination code. So we want to add the codes as we see it. So we want to add N1 8.9 comma And then we want to add I3 too. Okay, that's exactly how you do it. And you cannot separate the codes and you cannot flip them. They have to be written that way. Those two codes have to go together. Okay. Congenital syphilitic peritonitis. That should be one code. Peritonitis. Syphilitic is actually the descriptor of the peritonitis. So main code is peritonitis, syphilitic, and then down to congenital. Okay. This one might have two codes too. So let's see. Pericarditis. Pericarditis down to, or is it? No, sorry, peritonitis. Peritonitis. Okay, we didn't have to turn very far. And this is syphilitic. So we want to go to the S in syphilitic. Okay, and then it's congenital. And then again, it has the two codes there. And you write them like you see them, comma between the codes. Okay. Typhoid osteomyelitis is another one. This one should be okay. This is number 5. Osteomyelitis down to typhoid. And then this one here, venereal disease of the rectum due to chlamydia. Okay. All right. So this is infectious origins. So this one here, we're going to go to infection is where I'm going to start, and hopefully I can find it in there. Okay, infection, and then the type of infection is chlamydia. So we're going to go to the C's. Okay. Chlamydia, and then we're going to go down to, it does say rectum in here. So you can go to that and it should be good enough. Venereal disease is chlamydia. So you just have to get to infections to chlamydia down to rectum. So if we were going to look, we can log back in here. If we were going to coding, look at this. And we don't want this one or this one. Okay, if we went to chlamydia, or if we went to infection, okay, and then we went down to the C's. Here's the infection. And if we went down to, there's bacterial, bacteremia, go to the next one. Okay, chlamydia, and then we went down to rectum. We're going to find our code. We go to the back of the book and then we look it up. Okay. Okay. And there's one code. All right. Malignant neoplasm of the costal cartilage. Again, here we go again. So we're going to go to the neoplasm table and we're going to find the costal cartilage and it's malignant. So neoplasm table, and this is actually bone. So we want to go to, I would say neoplasm in your book, and then look at bone, go to the bone section, and then go to see if you can find that bone. And we are looking for a cartilage, right? We are looking for a costal cartilage. We can find cartilage. We have costal cartilage, and it is primary. So you should be able to find that code. So again, you want to go to neoplasm table, and then you want to go to bone. And then from there, you're going to go to the costal cartilage. Okay. And then verify your code in the back of the book. That one probably, that one should be okay. Okay. Acromegaly, main term. That's all you got. So don't code any higher than what you get when you look at an acromegaly. Okay. Peritoalveolar pneumopathy, and then to the location of the peritoalveolar. Okay, and that is just one code. Carcinoma in situ of the scalp. Again, neoplasm table, and you're going to go to, I would say probably skin and scalp. Let's check. So neoplasm table, then you're going to go to skin. Okay, and then we're going to go down to I would say scalp, but let me see if I have, let's see if I can find scalp. Skin scalp is going to primary is C44.40. We have basal cells, specified squamous cells, and it says carcinoma in situ. So we want to look at the carcinoma in situ. And if we don't know what carcinoma in situ is, secondary cancer in situ is the secondary column. But let's look it up in the book. Neoplasm table. Okay, and then we're going to go to scalp. Okay. SC scalp, and then this is carcinoma in situ, scalp. Scalp C79.2. And that's the only option you have for cancer in situ. Cancer in situ is actually the third column over. DO 4.4 is what you're looking at. Scalp over to cancer in situ, third column over is where you're going to find it. So it's actually this one right here is the cancer in situ. Okay, so actually, it doesn't matter. You're not using this system anyway. Okay, so that's your code. Make sure you verify it in the back of the book. Cirrhosis due to Wilson's disease. Okay, so this one here, we can look at disease Wilson, then go down, scroll down until we get to it. Let's see, or we can go to Wilson's. I'm going to try Wilson's because it might be faster because there's so many diseases in this book that it would take me a while to get to it. So I'm going to go to Wilson and see if I can find it. Okay, so WIL, Wilson disease and syndrome. I got a code there. All right, and then it does not have anything else that's indented into it. And so we're going to look and verify the code in the back of the book. Disorder of the iron and metabolism. Oh, wait a minute. Okay. Disorder of the copper metabolism. Okay. E83.00 is disorder of the copper metabolism unspecified. E83.01 is Wilson disease. It says code also associated Kaiser-Flaschen ring, which we don't have. And then the other option would be 09, other disorders of the copper, but it's not what we're looking for. So there is actually only one code here for just that Wilson's disease. Okay. Bubo due to hemophilus do cry. All right, so this one here only has one code too. So infection, I'm going to go to infection, but you know what? Maybe I'll go to the H's. Let's see. Yes, hemophilus. Okay, hemophilus influenza is cause of disease classified elsewhere, or it's it really does not give us enough information here. So we're going to go infection, and then we're going to go under the H's and see if I can get any better code here. Hemophilia, see infection, hemophilia. Let's see, infectious hemophilus. We've got, yes, it's found under hemophilus, infection down to hemophilus, and then you're going to find the Drew cry, any location, and you're going to find your code. Okay, and then you're going to verify it in the back of the book. So infection to hemophilus, and then to Drew cry. Okay. Carnitine deficiency due to hemodialysis. Okay, deficiency, and then the carnitine. Remember, there's quite a few deficiencies in here too. Cease, okay, deficiency. Cease. Carnitine, and you should be able to find it. And it says due to, and you have to look down and find hemodialysis. Okay, so you have to drill down. So deficiency down to carnitine down to due to hemodialysis, and then you can find it. So with this one, if I actually put this in here, deficiency down to, okay, deficiency down to, we're going to find the C's. Oh, I guess coagulation, color, facial factors, femoral fiber. Oh, I think I passed it. Oh, I think it's CRI. Deficiency alpha. CARN, gosh. It's too bad I can't have both these on both slides, right? It'd save me some time. Okay. Deficiency down to CAR. Carnitine due to hemodialysis is what it looks like. So deficiency down to carnitine down to due to hemodialysis, and find your code. Okay. Hypothyroidism due to iridation therapy. Okay, so this one, hypothyroidism, and then you want to look for due to's, and then that iridation therapy. If we went here, see hyperthyroidism, H. Where's the hyper? It's going to take me directly to it. Oh, I spelled it wrong. Okay, here we go. Now it's going to be faster. Okay, hyperthyroidism. Then from there, we're looking for due to iridation. So we're going to look and see if we can find a due to hyperthyroidism with no storm, due to atopic thyroid tissue with thyroid storm, specified. So this one here, Let's see. Okay, so with this one here, I did not see it under here anywhere. Okay, so we went hyperthyroidism down to with, but this one's not working with this with, so we went to hyperthyroidism is main code is EO 5.90. And it's not recurrent due to atopic thyroid issues, EO5. That's not really what we're looking for either. It is hyper, right? Hypo, no wonder. Well, let's put hypo in there. Hypothyroidism. See, that makes a big difference. Okay, hypothyroidism. Right here. Okay, due to, well, now we're probably going to find it. Irradiation therapy. There you go. That was easier. Okay. All right. Next one, airway obstruction due to laryngeal spasms. Okay. Well, you can look in the office section for laryngeal spasms and see what you come up with. If we come up with it for laryngeal spasms, laryngitis. Let's do airway obstruction. So let's do obstruction in the office section. Okay. And then we're going to do what's obstructed, which is the airway. Okay, we've got a code there. With, and then we can look down and see, do we have the spasms? We have with, chronic, due to, we do have a due to with laryngeal spasms, which is what we're looking for is the due to. So we're going to go down and look obstruction airway down to due to, down to inhalation, no, to down to laryngeal spasms. And then we're going to find our code. Okay. So one more time, obstruction down to airway down to due to, and then laryngeal spasms. Okay. Next one, we have bicornus uterus in pregnancy week 12. Okay, this is a pregnant mom again, so we know we're going to have an O code. Okay, pregnancy complicated is where we're going. So in the alpha index, we're going to look for pregnancy in the front of the book. Pregnancy complicated. Okay, so we're going to get to the pregnancy codes in the office segment section. Okay, pregnancy, and we're going to go to complicated, and then we're going to go down and we're going to look for bicornus uterus. Okay, abscess, bicornus or bicumate uterus, 034.0, and we're going to go back and we're going to actually do all of the characters in the back of the book. Now this one here, did we have a gestational age? Yes, we did. We have to add that. Remember when we go to pregnancy, clear over to the end of the pregnancy section where it says gestational weeks or weeks gestation, and we want to do the 12. Now remember when I told you Z3A is your base code for that, and then the weeks are based on the number of gestational weeks. So your last two characters are going to be 1, 2, but you can look that up in that alpha section. Pregnancy complicated. So we can go actually pregnancy for that second code, and we can go to weeks, and it's going to take us to, let's Go down. Okay, and it's going to say weeks of gestation in your book. And then from there, we're going to go to week 12, which is going to be the Z3A.12. Okay. All right. All right, next one, adenocarcinoma in endometriosis polyposis coli. Okay, adenocarcinoma is what we want to look at. Okay, I would look at it in your alpha section. Hopefully I spelled it right. Adenocarcinoma. Okay, adenocarcinoma says also neoplasm, go to the neoplasm table, malignant, and then by site, which means by body location. So you want to use the first column and you want to go by the body location where it's located. So in this case, we're going to the neoplasm table, polyposis coli. We're going to try that. Okay, so we're going to go to neoplasm table in the front of the book, and then we're going to go to poly. So let's see what we got. We got pole, pons, plexus, let's see, polyposis, ademotos, oh, I bet this is adenomatosis. Okay, so ADEM. ADEM. Let's see if it's under there. Okay, neoplasm. And is it adenoids? I'm going to look under poly again. In wall, connective tissue, skin, next. Okay. I got to pull the book out. Okay. All right. So neoplasm table, and we got to find this adenosis. We're looking for adenomatose. Adeno. Okay, I didn't find it under that, so I'm going to the P's. Those are drugs. Going too far. Okay, continued here. Neoplasm junction. Lung. Oh. Okay, well, there's lymphs. Nerve. That's in the nerve section. Nostril. Pancreas. Larynx. Pons. Pole. Pleural. Okay, so I am not, how about cool? Okay, so I can't get to this, but this is going to be one of those I think you're going to have to Google. Okay, so you're going to have to Google this adenomatous polyposis coli. Okay, to determine your body system in order to look it up in the neoplasm table. Okay. Or you can look it up in adenocarcinoma in the front of the book and see if we can get any guidance. Let's try that. I didn't try that. And there is adenocarcinoma in here in the alpha section. Adenocarcinoma down to poly. Papillary, pseudo. There is no poly. Let's go adenocarcinoma to the adenomas, adrenal. No, you're going to have to do some Googling on this one to find this one, to find the body part in order to find it in the system. Okay. In the code book. Okay. Uterine fibroid tumor in pregnancy, antepartum, second trimester, week 14. Okay. Again, pregnancy complicated down to uterine fibroid tumor. And then your second code is going to be fibroid tumor. Okay. And then your third code is going to be that, that week of gestation. Remember that pregnancy to the week gestation and find your 14 weeks. Okay. We're gonna get rid of that. Okay. Keratoconjunctivitis in exanthema. And that one there is just one code. And all you're doing is going to keratoconjunctivitis and down to find that exanthema, right? Next one is one code also, nephrosis and epidemic hemorrhagic fever. This is an infection. So you can go to infection and then you can go down to hemorrhagic fever, epidemic, and then in nephrosis to find that one, okay? Appendicitis with perforation. Appendicitis is your main term. And then you want to go down to with perforation. Thyrotoxicosis with unionodule anemosis goiter. You can look at thyroid toxicosis and then down to with to find your unionodule anemosis goiter. Okay. Traumatic hemothorax with pneumothorax. Hemothorax down to traumatic. And then you can look down to see with pneumothorax if it's in there. Okay. Should be one code on that one. For adjustment disorder with anxiety. Okay. This one here, you can go to disorder adjustment and then down to with anxiety to find your code. Skull agenesis with anencephalus or anencephaly. Agenesis down to skull, and then indented should find with anencephalus and or encephalopathy. Next one, abnormality. This is just your state, your cross-reference. This is not coding. So you're going to go to abnormality, or abnormalities, and you're going to see what is the verbiage that it states. Does it say see something? Write it down. That's where you want to put in there. See blah, blah, blah. Okay. Same with tocosis. Same with strangulation. Undescended testes, same thing. Proteinuria, complicated pregnancy, same thing. And then we get back into coding again. The patient admitted with difficulty breathing and fever, physician discharge diagnosis of pneumonia. These are all symptoms of the pneumonia. So all you want to code for is the pneumonia. Okay. This was actually checking how we know what we can and should and should not code for because of signs and symptoms, or is there a diagnosis for those signs and symptoms? So a patient was admitted with malaise, physician discharge diagnosis was depression. Depression is part of the malaise. So, or malaise is part of the depression. So you're only going to code one code and depression is going to be your code. Okay. It's a general depression code, nothing reading into it. Okay. The patient admitted with severe headaches, the physician discharge diagnosis is intractable migraine. So you do not code for severe headaches. All you do is migraine and find intractable. Okay. The patient admitted with abnormal pain and fever, the physician discharge diagnosis is acute appendicitis. This is a sign and symptom. We do not code for it because the diagnosis was appendicitis, and that does cause abdominal pain and fever. okay, because of the infection. So appendicitis is what you're coding for. And then the last one, the patient was admitted with pain and swelling left ankle. The physician discharge diagnosis was sprained left ankle. This one here, sprain left ankle, because these are symptoms. Swelling of the left ankle is a symptom of the sprained ankle, okay? Make sure you go for every single time that you find your code, make sure you look it up in the back of the book to get all your characters. Look for that red box in the back of the book, that little red box that gives you the number on how many characters you have to have. Okay, and that's it for this assignment. Email me if you get stuck or if you want me to go back over a specific question. Okay, thank you. And I will be posting more videos as we go. Okay.